On-the-scene video coverage of ESC 2012 is supported by Pradaxa.
Well, I'm Chris Cannon here with Deepak Bhatt to do a preview of the late-breaking clinical trials from the upcoming ESC meeting. As always, we look forward to the late-breaking trials, and I think Trilogy is probably one of the biggest ones. You're on the steering committee. Do you want to tell us a little bit about the trial?
Sure. It's an interesting design pitting prasugrel versus clopidogrel in patients who are initially medically managed for their acute coronary syndrome. So a lot of times, of course, we focus on PCI and ACS. This is focusing on the inverse, that is, folks that don't have PCI as part of their initial planned strategy, really to see if there's a role for prasugrel in the medical management of ACS.
That's terrific. And it's a big trial, I think 10,000?
Yeah, over 9,000 patients, and there's a lot of science embedded in it. I just presented the main design in question, but several other important questions are on there. There's a large platelet function sub-study embedded in there. Actually, that'll be presented at AHA as a late breaker. There's a contingent of older and younger patients, so a lot of good science. Also some data about longer-term therapy. A longer median duration of follow-up in this study than in prior antiplatelet trials. So I think there's just going to be a lot of good data coming out of it.
Oh, terrific. Also some good interventional trials. I think the FAME2 trial we've got a snippet of, but you want to preview that a little bit?
Sure. You know, I think I'm excited about FAME2. Probably lots of interventionalists and cardiologists in general are. The top-line results are sort of known. It's known that the Data Safety Monitoring Board stopped that trial, which uses FFR to guide revascularization, because the folks that got revascularization after their positive FFR, quote unquote, did better. But hopefully now we're going to see the actual details of what doing better means. Certainly what we'd heard from the DSMB initial release was that there was less need for urgent procedures afterwards. But were there any effects on harder endpoints, MI death? I think we're going to find that out at ESC, whether there were or were not.
Oh, terrific. Well, certainly that's a new and emerging strategy. A big trial may really change how patients are managed in the cath lab.
Yeah, I think there'll be a lot of discussion around this trial. I think folks that have got a bit of an interventional bent, like myself, will see a very positive trial. I think others may focus on hard endpoints like death or MI, where we'll see what it shows, but my prediction is there's probably not much of an effect given the relatively short follow-up.
Okay. Well, the Prague series is up to 12, and they have a study looking at the use of the maze procedure during surgery as opposed to not doing that in patients having CABG. That could be hot. Certainly AFib is a big problem post cardiac surgery.
Absolutely. AFib, very common after CABG, associated with all sorts of badness, certainly increased lengths of stay, that sort of thing. And if throwing a routine maze in there helps these patients, that actually would be a big advance.
Yeah. Any others that come out that you are looking forward to?
Well, there's really a lot of good stuff, but one other that I think is very timely, albeit a relatively small sample size, is the West trial that's randomizing patients who are in need of triple therapy potentially to two different strategies of what that triple therapy means. So I think will definitely shed light on whether we should be using double or triple therapy in patients, say, with stents and an indication for anticoagulation.
Oh, it's true. Well, that's probably one of the biggest vexing problems we all face. And so hopefully these and the other trials will be practice changing potentially. So stay tuned on CardioSource MedPage Today. We have this collaboration of the ACC and MedPage Today, and we're delighted to preview an exciting meeting.